Hello, my name is Yetunde Onabajo. I'm an MPH student at the University of New England. For my presentation, I will be addressing the public health issue of maternal mortality rate in Afghanistan. As a health educator, I chose this topic because global MMR is at an unacceptably high rate, and as one of the health indicators of a nation, the high MMR in Afghanistan indicates that this country is unhealthy and requires immediate attention from health professionals and organizations. The World Health Organization reports that Afghanistan has one of the highest MMR in the world. As of 2015, the MMR for the nation was recorded at 400 deaths per 100,000 live births. Although this number is a significant improvement from the country's ratio in the 1990s, where the recorded MMR was 1,340 deaths per 100,000 live births. The country still has one of the highest MMR in the world. Afghan girls are more likely to be married around the age of 15, and this leads to young maternal age, frequent pregnancies, and maternal complications that contribute to the high ratio of maternal mortality. Due to a weak economy and poor infrastructure, Afghanistan's health clinics and hospitals are impacted because of lack of funds to staff, purchase medical equipment that are needed to run these facilities. In the conservative areas of Afghanistan, there is lack of medically trained birth assistants and midwives to provide adequate prenatal services. Lack of access to education for young girls is also a major public health issue in Afghanistan. Young girls are less likely to be educated, but rather groomed for marriage. The tradition for early marriage and a lack of effective family planning leads to frequent pregnancies at an early age, thus increasing the risks for maternal mortality. The Millennium Development Goal strives to significantly improve maternal health. Improvement of maternal health requires understanding factors that influence maternal deaths. So as a health educator, the use of the social ecological model allows me to understand the range of factors that put people at risk for a particular health issue. The model illustrates how factors at one level influence factors at another level. At the individual level, my goal in Afghanistan will be to educate young girls around attitudes, beliefs, and behaviors that promote reproductive health services. So, increasing knowledge around reproductive health at a young age is important, and one of the effective ways to promote this knowledge starts with personal beliefs and change in attitude to improve one's health. At the interpersonal level, it is also important to communicate the need for change around the tradition for early marriage. Reducing young girls to no more than wives and childbearer material is terrible. But families probably do not see it as such, since early marriage is a common cultural norm. So, as a health educator, my role at this level will be to promote an understanding of the impact of early marriage and pregnancies on young girls. At the organizational level, involving health workers, community-based organizations, state and local health departments, and even the traditional birth assistants to develop interventions and programs that promote reproductive health services and family planning. At the community level, it is important to involve the media, research institutes and universities, local community birth homes to advocate for change that promotes reproductive health services and reduce maternal mortality. And at the policy level, involving federal and state officials, non-profit organizations in Afghanistan to advocate for policies that will enable young girls to go to school and delay marriage. These two are the most important factors that can significantly reduce maternal mortality in Afghanistan. Um, the proposed intervention based on evidence-based interventions. There is new global consensus that agrees that evidence-based interventions will sharply reduce maternal mortality. These interventions are designed to facilitate decision-making among low and middle-income countries, where 99% of maternal mortality is occurring. So one of the interventions includes education of young girls and women, as a key driver to reduce maternal mortality. Education empowers women to learn more about their health and their environment. And as a health educator, I will adopt these interventions in two steps. First, meet with community leaders and with respect, discuss the advantage of education among girls, citing global leaders, female leaders who have brought changes to the world, partly due to their educational background. And number two, I will work to promote a culture of autonomy among women and to teach them about the importance of education, not only for to their individual health, but for their family, their community, and ultimately their nation as a whole. Another intervention that I will adopt is to train community health workers and or traditional birth assistants to recognize early warning signs of pregnancy risks and to understand the benefit of referring such risks to hospitals for clinical care. Studies have shown that when birth assistants are trained in such programs, there is a significant increase in health practices which improves maternal measures. So these practices include hand washing, sterilization of birthing areas, immediate feeding of colostrums to the infant, and increasing the numbers of referrals to a health facility to reduce pregnancy-related complications. Another evidence-based intervention, includes family planning. And this allows people to attain their desired number of children and determine spacing of pregnancies through the use of contraception. Family planning is essential to well-being and autonomy for women and couples, and at the same time, it supports health and development of communities. Family planning also prevents sexually transmitted infection. It's been shown to prevent HIV. People are not having multiple sex partners. They're not going outside of their relationships to have sexual encounters. Family planning has also been shown to reduce the number of unsafe abortion. Unsafe abortion has been found to lead to fatalities. But when there is family planning and the use of contraception, people can prevent pregnancies. The fourth intervention that I will adopt is the provision of antenatal care and childbirth support. So antenatal care involves the promotion of the use of iron and folic acid fortification, encouraging women to get their tetanus vaccinations, and for childbirth to um, provide social support during childbirth, and to encourage women to take calcium supplementation to prevent hypertension. And hypertension has been known to increase a woman's risks for preeclampsia. And preeclampsia has been shown as one of the pregnancy related complications that leads to maternal mortality. Proposed evaluation. Community encouraging community leaders and local health officials to participate in weekly meetings to share their cultural beliefs and understanding around maternal health. So as a health educator, my goal will be to facilitate these meetings to to show that a young girl's body is not mature enough to carry pregnancy, and not just one pregnancy, but frequent pregnancies. Again, my goal will be to participate in these weekly meetings to educate around um, young maternal age and young girls getting married. Community-based schools, another evaluation will be to ensure that community-based schools are improved or set up to allow for girls' education. Another evaluation will be to ensure that teachers are trained to teach about reproductive health, family planning, and about health in general. To also ensure that school curriculum includes reproductive health information, family planning. And to also another evaluation will be to ensure that women and couples are proactively discussing the use of contraception as part of their family planning process. So when they're meeting with their doctors, they are proactively discussing the use of contraception. And another evaluation will be to ensure that there is continuum of care that involves home visit for new mothers and their newborns. So I will measure success. I will know that these interventions are successful when community leaders can link specific cultural practices, such as early marriage, to maternal mortality. And they are not only linking it, but they are actively advocating for changes in these cultural norms, and they are promoting education and late marriage for their girls. I will also know it's successful when there is improved access to schools and education for girls, and when traditional birth assistants can demonstrate knowledge of essential health attitudes that promote maternal health, and there is increased access to contraception for women, and that there is an increase in rate of use of contraceptions. There would also be, I would also know it's successful when women are receiving antenatal care that promotes the use of iron and folic acid fortification when they receive their vaccination, and calcium supplementation to prevent elevated blood pressure. With that being said, there certainly will be challenges and barriers. So one of the challenges could be lack of funds from the Afghanistan government to build community-based schools to improve education for girls. Women and couples may not want to adopt family planning due to cultural or religious beliefs, and a weak economy due to war and conflict in the region. And then, of course, there could also be a lack of financial transparency from the government. One of the ways to the possible solution to these barriers may include seeking funds from outside foundations such as the Bill and Melinda Gates Foundation, the World Health Organization. Another solution could be to continue collaboration with community leaders to discuss how family planning can be incorporated with cultural beliefs. So, not necessarily throwing out the cultural beliefs, but looking for ways to incorporate these two together. And to also learn to be patient and continue to distribute and campaign about contraceptions, and to increase discussion of maternal health using evidence-based materials from international organizations such as UNICEF, World Health Organization. Here's my logic model that ties everything together, from the goal, which is to reduce maternal mortality rates in Afghanistan, to the resources, the inputs, the activities, and the outcomes of merging all these resources together. Thank you very much for listening to my presentation. I hope your organization will review this information and material and decide to fund efforts to reduce maternal mortality in Afghanistan. Thank you.